What do you do when a patient comes to you and says they have gastrointestinal problems? And what do you recommend they do? How well does it usually work?
So most people in America actually do have some kind of GI problem, right? You can go to the store and you can see the whole aisle of, here's your, purple pills and your antacids and and then you have the, the products for the constipation and the diarrhea. So all these IBS symptoms are all actually inflammatory-based symptoms. Okay, again, GERD is just esophagitis, gastritis, colitis. All these aspects are inflammatory triggers. And so when patients come to me, we first look at the diet. We first look at what we should look at that are foods that are coming that may be potentially triggering those inflammatory responses. And then more importantly, we investigate their microbiome. So every patient, what we look at is when we talk about their microbiome is your GI tract, right? And 80% of your GI tract is where your immune system is located. So we like to look at the individual aspects, and now there's testing that can be done where we can look at how is your digestive enzymes. Are you breaking down your foods like proteins and fiber and fat? Are you eating enough of those? Is there any kind of inflammation in the bowel? Is there any kind of overgrowth in the bowel, like a small intestinal bacterial overgrowth or fungal overgrowth like a yeast or a candida or even a parasite? Right? And now once we have that aspect, so we can actually retarget, restructure, restore this GI tract. And so the GI tract is the first place where everything comes in, whether it's a medication, whether it's a food, that's the first point of entry. And if we fix that point of entry, then usually that initial trigger of inflammation is stopped in its tracks. So we always have to look at doing that. Now, you asked, the question was, how often or how well does that work? Well, it works in everybody. The question is, are they willing to do the lifestyle changes to continue to maintain that healthy lifestyle? And that's the challenge. And so what we like to do is we like to teach the patient, how to shop, how to cook. Here are the ways that we keep them motivated. Can you also develop a community where you can eat very similar foods and participate in activities where you're not constantly insulting that GI tract with, either improving your immune system so you can get less antibiotics when you're sick because you're stronger and your immune system is stronger. How do we actually look at eating healthier foods like organic foods, so where there's less pesticides, herbicides, endocrine disruptors that cause dysfunction in the gut? So the challenge is easy to fix everybody's gut, even patients that have colitis. That's our easiest patients to change. Anybody has autoimmune disease or anybody has like IBS, simple. The question is, are they healthy enough or responsible enough in a way to not fall victim to what the system has, here's the convenience food, here's the easy pill to take so I can treat my symptoms. But if we go to the underlying cause of disease, all diseases can be reversed.
Are there different types of food sensitivity, reactions, and testing?
Yes, so there's two types of reactivities with foods. And again, some people call them allergies, some people call them sensitivities because the word is really broad. But in essence, there's an IgE, there's an immediate reaction that people can have within 1 hour. Again, Western medicine's been trained for that 2%, like for patients like me, that we can eat something and have a serious reaction, anaphylaxis. So you'll hear nut allergies, melons, and certain people like, oh, I have a peanut allergy, I have a shellfish allergy, for example. So those are very rare, but they're very serious. So we're good that when people get those type of reactions, we have Western acute care, right? We have an epinephrine, we have steroids. If we have to, we can intubate someone and put them on a ventilator, right, and save their life. That's happened to me many times in my lifetime, by the way. So I'm really proud and really happy that we have acute care in Western medicine. However, the chronicity of diseases is the second aspect where they're delayed foods, where you can eat a food and anywhere from a few hours after you eat up to 4 days later, you can then get an inflammatory response. Remember, that inflammation goes systemically. So wherever there's an itis in your body, that will trigger that to get worse. Now, what we have to look at is that many practitioners, conventional doctors, only look at IgEs, and they only look at the anaphylactic ones. So they may only pick 5 things: eggs, dairy, shellfish, and peanuts, right? And eggs, for example. So they're only looking at, are you going to die right now today in my office? And this is something I can give you. But they're not looking at the whole spectrum of all the foods you eat because they're not concerned about things that can be not life-threatening, but also life-devastating over time. Likewise, alternative practitioners can only order delayed foods because they're not doctors in the MD world. So they can look at delayed foods, but delayed foods can have problems because delayed foods can have false positives, and also delayed foods are things that also are temporary. These are things that we can eliminate from the diet and then rotate them back in the diet in a specific fashion, which will educate our patients. So a lot of people get testing, they're either not tested fully enough, or they're tested and they say, oh my God, I'm allergic to everything, I can't eat anything, right? The goal is that they need to have the specific guidance, and we have the experience on how to provide that.
How important is the microbiome, and can that be tested?
Yes, so as I was mentioning, the microbiome is everything. Right now we're in the science where we're just touching the tip of the iceberg of the microbiome. Again, 80% of your immune system is in the GI tract. So we have to look at, how do we feed those probiotics? And those are our immune system. So when we think of, there's 100 trillion colony count of over 1,000 species that weighs 4 pounds. That's a lot of nice organisms in our gut. But there's also aspects of dysfunction and overgrowths. So we have to look at, how is this digestion, absorption, assimilation, and excretion, how is this working? Because you can eat the perfect diet, and if your gut's wrong, you're not getting the benefits. You can take the perfect supplements. If your gut's wrong, you're not going to get the benefits. You can pick the most advanced drug, latest and greatest medication, and again, so there's a rate-limiting step, and that's the GI tract. So we always test the microbiome, and then we restore it, we correct it, and then that's when medications, drugs, and supplements, and even food becomes medicine.
For people who have dysbiotic bacteria, fungal overgrowths, or parasites, do you recommend antibiotics, or is there some other natural approach? Do they use antibiotics for this in the other 200 countries outside the U.S. for that matter?
So to answer that question, we like to investigate and actually test the microbiome specifically. So we don't just go off of symptoms. So a lot of practitioners will be, especially in the alternative world or sometimes in the holistic world, like chiropractors and naturopaths and just other healthcare practitioners, they'll go, oh, you have gas or bloating, and it sounds like candida, and then give a candida product, right, or a candida cleanse or something, right? Or it sounds like parasites, and they give. So every practitioner has their kind of, oh, I think it's this. Even GI doctors, they'll go, oh, I think it's small intestinal bacterial overgrowth, SIBO. Here's a $2,500 new prescription drug that will kind of kill those bacteria. But all those things are not as targeted as we want. What that means is that when we do microbiome testing, from the patient's own results, it is tested to look at sensitivity and resistance. What that means is that what is those microbes, if they're bad ones, or they're overgrowths of those good ones, which drug do we give, and which herb can we give that is sensitive to it? So we don't give what we prefer. Doctors like to provide this, or herbalist will be, this is my favorite herb, or the patient will be, I love to take this over the counter. It's like, what actually works? Because when we go into the gut, I look at the gut-like history. We can't just go in and invade without true weapons of mass destruction. You have to have evidence, because if we go in and we cause that, if we go in and we invade, then we're actually going to be there for a long period of time, as history's told us. So what happens is, what people don't understand is that natural products also knock out good stuff, right? This is antimicrobial. So last night we were at this, the conference. We had a wonderful panel, and people were talking about antimicrobial herbs, and I was like, yeah, that works. But you have to have the guidance, because these are just like antibiotics. You wouldn't take antibiotics every day for months, but a lot of people take, oh, I had candida once, and they might have, and then they take an anti-candida product daily for months, and I'm like, but you wouldn't take an antifungal daily. You wouldn't take amoxicillin daily if you had a bacterial overgrowth. So this is where people don't understand that they have to respect the plant medicines are medicines, and that's why we can give an integrative practitioner can give that guidance, because we have to give these things targeted for a specific amount of time, but also help restore that gut, because again, even things like oregano and uva ursi and berberine and all these things also can have negative side effects if you take them too long or untargeted use.